Good evening, everyone, and welcome. Thank you for joining us today. On behalf of the Global Health Institute at the American University of Beirut, I'm pleased to welcome you to our webinar, Rabies in the MENA region, Strengthening One Health Preparedness for a Preventable Epidemic. This session is hosted by the Epidemic and Pandemic Preparedness Program at the American University of Beirut, GHI, and we're happy to have participants joining us from across the region. I would like to start by introducing our speaker for today, Dr. Atika Berri. Dr. Berri is the head of the Preventative Medicine and Communicable Disease Department at the Lebanese Ministry of Public Health and leads the National Antimicrobial Resistance Committee. She also serves as Lebanon's focal person for the WHO International Health Regulations and is a professor of emergency preparedness and response at the University of St. Joseph. Dr. Berri will be sharing her expertise and insights on the regional context, key challenges, and the role of One Health in strengthening preparedness. Before we begin the main presentation, I would like to invite Ms. Nourissa, EPAPP Program Manager, to give a brief overview of the Epidemic and Pandemic Preparedness Program and the work we do at the Global Health Institute. Noor, please go ahead.
Thank you, Riem. Again, hi, everyone. Thank you for joining this webinar. I will be presenting very briefly the Epidemic and Pandemic Preparedness Program at the Global Health Institute at American University of Beirut. So first of all, starting with the Global Health Institute, GHI, it was established in 2017, and it's the first such institute in the Middle East and North Africa region, MENA, among the very few in the Global South that addresses global health challenges through an interdisciplinary and contextualized approach. The Global Health Institute functions through three main divisions. The first one, that's the programs, that's the research and policy division. Currently, we have five ongoing programs, such as the conflict medicine, the ESAHA, that stands for Digital Health Program, refugee and migrant health, the epidemic and pandemic preparedness, which we are gathered for today in the webinar, and the very recently established program that's the climate change and impact of climate change on health, that's the CLI Health program. The second division that we have in Global Health Institute is the academy. This is the capacity building division, where the academy has several initiatives and flagships, one of which, the very important one, is the GLAD, which is an online learning platform, which hosts certificates, diplomas that are created by research teams and certified by the AUB. One of few examples of these certificates are mentioned here in the slide, such as the Humanitarian Leadership Diploma, a certificate in NGO management, the recently launched certificate in Epidemic and Pandemic Preparedness, which I will get back to at the end of this presentation, certificate in climate change, and others. And the third division that we have at the Global Health Institute, that's the Assist, where we provide community services and support for non-governmental organizations. At GHI, we function through partnerships at national, regional, and global scale. And we have our own support service departments, which includes communications, web development, finance, and others. Going back to the epidemic and pandemic preparedness. So the world is at constant risk and threat of pandemics. The COVID-19 pandemic was not an anomaly, but rather a warning that we are not prepared. Over 70% of the world remains underprepared for a major pandemic outbreak. And the economic cost of pandemics can reach over $1 trillion per year. Therefore, investing in preparedness is not an expense, rather it's a vital investment in global security and economic stability. To zoom in on the MENA region, the MENA is uniquely vulnerable due to several factors, but the four critical ones are the ongoing conflict and instability in the region, which weakens the health systems and infrastructure, the ongoing displacement of populations that's leading to limited access to care and higher outbreak risks, the health workforce exodus with the loss of healthcare professionals and limited training, and the unequal health capacities, which leads to variability in preparedness across the region. Hence comes the Epidemic and Pandemic Preparedness Program, EPAPP, which serves as a regional and global model for preparedness through three major drivers. That's informing evidence-driven policies, strengthening context-specific capacity building, enabling high-impact research and practice. EPAPP has led and accomplished several initiatives, which I will highlight today. So the first initiative is the Preparedness Stakeholder Map and the Preparedness Collaboration Portal, which fall under the Pandemic Preparedness Gateway. The second initiative, that's the Pandemic Preparedness Information Hub, And the third initiative is the Certificate in Epidemic and Pandemic Preparedness, which we refer to it as SEP. So our work in EPAPP is guided by the ECDC framework, which categorizes how pandemic preparedness should be done through categorizing what are the domain and what are the workforce. So for the domain, we have 5 major domains for pandemic preparedness. That's the detection and assessment health services, coordination, communication, emergency risk communication, and policy development, adaptation, and implementation. As for the workforce or involved in pandemic preparedness, these are divided based on if they are policymakers, emergency managers, clinicians, public health practitioners, risk communicator, and civil society leaders. Going back to our first initiative that we accomplished, that's the pandemic preparedness stakeholder map, which is an online interactive stakeholder map that allows users to understand the identity and interlinkage of pandemic preparedness stakeholders by filtering by name, country, contact information. So this is an available map found on our website and also found on a mobile application where end user can search for any stakeholder among the 22 MENA countries. So far, we have mapped over 2,500 individuals from 580 different organizations. The second initiative, that's the Preparedness Collaboration Portal, which is like a community of practice of researchers that allows, so it's also an online website, online portal that allows end users, whether policymakers, researchers, health practitioners, and others, to identify and collaborate with experts publishing in the field of epidemic and pandemic preparedness and response across the 22 MENA countries. So far, we have identified over 10,300 individuals from several different organizations. The third initiative, that's the Preparedness Information Hub, which acts as a resource center for researchers and practitioners, and that include mostly gray literature that revolve around epidemic and pandemic in the region. So these are mostly guides, data sets, visualizations, reports, manuals around the epidemic and pandemic preparedness. And this is also a website that will soon be available for everyone to use. As I mentioned, these websites that are readily available, these portals are readily available on our GHI AUB website, and we have developed a mobile application that has these tools readily available, and it's free to download to anyone who is interested. And these are the QR codes if anyone is interested in downloading this mobile application for free and to use it or to disseminate it as well. I'll just give a few seconds if anyone is interested to scan the QR codes. Moving to the last initiative that we have in EPAPP, which is the Certificate on the Epidemic and Pandemic. This is an evidence and needs-based online self-paced certificate made of 4 courses on epidemic and pandemic preparedness. Most importantly, that it's tailored to the MENA region because it was developed by MENA experts and it's tailored to the MENA professionals, and it's delivered on our online learning platform called GLAD. So the certificate was done through an iterative process, which involved first the review of capacity building initiatives and identification of the framework that we use to develop the certificate. That's the ECDC framework for pandemic preparedness. And then we did a training needs assessment with targeting healthcare professionals and experts to ask them to rank the competencies and to rank different domains and the competencies, what are important and how well are they performing this in their job. The training needs assessment was followed by a Delphi survey in order to reach consensus on what are the critical and important competencies to include in this certificate. That again, it is a tailored certificate made of 4 courses, and these courses are developed by MENA professionals. So we have the first course that's on detection and assessment of disease outbreaks, which equips the learner with the skills needed to detect, assess, and monitor epidemics and pandemics using epidemiology, surveillance, laboratory analysis, and risk assessment. This was developed by Dr. Soha Kenj. The second course is the policy development, implementation, and adaptation that equips learners with the skills needed to develop and adapt health policies for rapid, coordinated epidemic and pandemic response, focusing on the MENA region preparedness. And this was developed by Dr. Atika Birri, our speaker for today's webinar. The third course that's on health services preparedness for the epidemic and pandemic, where the learners, they gain the skills needed to prepare and strengthen healthcare systems for pandemics in the MENA region, focusing on threat management, communication, coordinated responses. This was developed by Dr. Nisreen Rizq. And the last course in the certificate is the emergency risk communication in epidemics and pandemics, where the learner develops the leadership, coordination, and strategic communication skills to manage public health crises and strengthen resilient preparedness systems. And this was developed by Mr. Zahi Shaheen from UNDP. The key advantages of this certificate is, as I mentioned before, it's contextualized. It's created by MENA experts for MENA professionals. It's evidence-based. The learner can take this certificate or take this course anytime, anywhere. It's fully online and self-paced, and it will undergo later on rigorous evaluation using GHI evaluation framework. If you are interested in taking this certificate, please feel free to scan this QR code or feel free to visit our GLAD GHI website to register in this certificate. Thank you so much. And now I will leave the floor to Dr. Atika Berre, who will be presenting the webinar. Thank you.
Thank you, Reem, and thank you, Noor, for all the efforts you are conducting in this important, really important programs. يعطيكم العافية. Okay, I will share my screen. Can you see my screen?
Yes,
Okay.
we can see it.
Okay, so first I will start by a small intro by the outline of the presentation. I will start with a small introduction, and then I will talk about rabies. What is it? Because a lot of people actually don't know what rabies is. Why it matters, why rabies matters. I remember that Noor several times talked to me and asked, do you really want to speak about rabies? So yes, I do want and I do need to speak about rabies, and I will show you why I insisted on this subject, very important subject. Then we'll move to myth and facts regarding rabies. The global strategy 0 by 2030. Then we'll go rapidly to an overview in Lebanon regarding rabies. Then we'll move to an overview in MENA region from different perspectives, animal, human, and environment. After that, we'll talk a little bit about the situation in the MENA region over time from the period 2000 till 2025. Then we'll talk about the One Health as a golden framework to fight rabies. Then we'll talk about the One Health in practice, key components specifically for the MENA region. Of course, we need to highlight the challenges and opportunities in our region, and the actuality, the role of AI in rabies control. After that, we'll end the presentation with some data from Lebanon and a conclusion, of course. I will start my presentation with a critical bite story. He was 14, he had scratches, his puppy looked healthy. This is a true story that captures why One Health is essential in eliminating rabies in MENA region. And it reveals the cost of misinformation and fragmented systems. The deadly gift. Actually, the boy received a puppy as a birthday gift. His family, his parents, gave a quick call to the local vet. They asked him about if it's okay. He reassured them and said, okay, puppies rarely get rabies. A few days later, minor scratches were seen on the boy's arms and forearms, and few weeks later, symptoms appeared, hydrophobia, neurological symptoms, etc. And the teenager, unfortunately, lost his life due to rabies, a disease that is 100% preventable. Rabies is one of the most important zoonotic disease and unfortunately one of the deadliest known infectious disease in the whole world. And unfortunately also it is neglected. We called it neglected. It's among neglected tropical diseases because, you know, the developed countries don't have rabies anymore. So it's really only specific to developing countries, البلدان النامية. MENA region faces persistent endemic transmission, especially in rural and peri-urban communities. And dogs represent the principal reservoir in the MENA region, followed by cats. And it's important to know that once clinical symptoms appear, rabies is fatal in 100% of cases. So there is no cure for rabies in the whole world. Even the very few cases, I think like 6 cases all over the world were cured from rabies. Nobody knows why and how they got cured. Usually it's 100% fatal. What is it? It's a viral zoonotic neglected tropical disease, as I said. It's caused by a virus called rabies virus. It's a member of the Lisa virus. Lisa in the Old Greek mean madness, and the nomination is due to the neurological symptoms the patient suffers from. The incubation period varies from few days to few months, but it's typically from 1 to 3 months. A transmission occurs through the saliva of infected mammals via bites or scratch, and it targets the system, the central nervous system of humans and animals. Here we see in the picture how the virus enters to the bloodstream through a bite or scratch, and I insist on scratch because we have witnessed several deaths due to scratches that were left untreated. So through the scratch or the bite, the virus replicates locally inside the muscle and then moves toward the peripheral nerves, and from there it walks to the central nervous system to reach the brain, where once it's there, nobody can do anything for the patient, and they lost their lives. Symptoms at the beginning, they are unspecific. They are almost like flu-like illness. The persons suffer from fever, headache, weakness, wound tingling at the site. Then, after a few days, sometimes weeks, he becomes to suffer from anxiety, hydrophobia, muscle spasm, agitation, hallucination, seizures, paralysis, coma that leads finally to death. The risk groups are mainly anyone working in the agriculture sector, the vet service workers, military personnel, children specifically are at high risk, and persons exposed to stray or wild animals such as refugees, displaced persons, and low-income groups. Why this disease matter? As I said, it's 100% deadly, yet it is 100% preventable if we act on a timely manner and we use the proper treatment. Globally, all over the world, we have more than 59,000 deaths per year. 50% children under 15 years, mostly from dog-mediated rabies. That means every 9 to 10 minutes, one person dies in the world, and around 300,000 people are exposed globally. Sorry, this is a mistake. No, it's okay. 3,000 people every 10 minutes. It's okay. 150,000 to 250,000 exposures per year, and 230 to 300 human deaths per year from dog-mediated rabies in the MENA region are observed. And the post-exposure prophylaxis usually prevents about 272,000 deaths every year. So it's very important to tackle the PAP and to be sure it is available all over the countries in the MENA region. Due to its widespread, its public health concern, and its vet implications, and its resulting economic impact, we should achieve elimination in order to have a large gains for public health and animal health and the environment. Sorry. There are several myths, and I insist to reveal the most important, because every now and then I receive call from physicians, not only from public, from physicians, especially pediatricians, asking if a cat has scratched a baby or a child, is it okay not to give the rabies vaccine, especially if it's a stray cat? Of course, this is not true. We should give the PEP, the post-exposure prophylaxis, as needed. If it's a cat, if it's a dog, if it's any mammal, like horses, like cows, any suspected rabid animal which attack any human being should be treated as rabid. Suspected rabid should be treated as rabid, and the PEP should be delivered accordingly to the patient. So this is very, very important. The global strategy launched by WHO Zero by 2030 aims to end human death from dog-mediated rabies by 2030. The main objectives of the strategy are the efficient prevention and response by the use of vaccines and tools such as SOPs, guidelines, etc. Generate data, policies, governance and measurements, sustain commitment and resources. Actually, a lot of countries have the tools in the MENA region, but success depends on funding, coordination, and execution. Actually, funding is a very important issue, and a lot of countries lack of funding. Therefore, they cannot move with their plan or their activities in order to eliminate rabies. In Lebanon, we record around 1,800 to 2,500 exposures per year, with 1 to 2 deaths per year. Dogs are considered the main source of human rabies infection. We'll see more details at the end of the presentation. The country consumes approximately 8,000 to 10,000 rabies vaccines and 2,500 to 3,000 anti-rabies immunoglobulins each year. The best prevention method is controlling stray dogs and animals using One Health approach, as outlined in the joint plan issued by the Ministry of Agriculture in coordination with all relevant sectors. We have the municipalities, we have, of course, the Ministry of Health. It was updated in 2019. Here are, I have actually two studies published, one in 2014 and the other in 2018 regarding human rabies control in Lebanon, a call for action, how it's important to work together to fight rabies in Lebanon and of course in the whole MENA region. From the animal overview, and if you want to tackle rabies in the MENA region, it's important to re-stress about the dog-mediated rabies as the dominant route of human infection in most countries in the MENA region, such as Lebanon, Syria, Iraq, Yemen, Egypt, Morocco, and Algeria. Surveillance gaps makes the true burden unclear. Many animal cases are undiagnosed, unfortunately, or underreported. Inconsistent dog vaccination rates are observed widely in the MENA region, and only very few countries reach the WHO coverage recommended, which is equal or above 70%, which is the coverage needed for herd immunity among dogs. Cross-border animal movement, stray dogs, informal trading of dogs and livestock contributes to sustained transmission. Actually, if you go to Al-Masna in Lebanon, the cross-border land crossing between Lebanon and Syria, you will see many stray dogs. I've been there several times for assessment of the border, and you will see stray dogs everywhere. Conflict zones also play a big role in the MENA region, such as Lebanon, Syria, Yemen. Because of these conflicts, we experience major disruptions in public health and veterinary services, worsening the exposure risk. From the human perspective, we witnessed inequality in the access to post-exposure prophylaxis and rabies immunoglobulins across countries. For example, rural populations often face delays or scarcity of these medications, especially regarding immunoglobulins because they are expensive. Usually they are expensive. Limited laboratory capacity for rabies confirmation is also a gap, especially outside capitals, and some countries don't have a way don't have a lab to confirm the rabies disease, so they will be obliged to send the samples outside the country in order to get the results. And this takes time, a lot of logistics and so on. We used to do that in the past, like 5 years or 7 years ago, but not anymore. Now we are able to diagnose rabies inside Lebanon with the help of the Ministry of Agriculture, actually. Fragmented reporting systems across ministries weaken timely action. So it's very important to unify the reporting system in order to be acting on a timely and properly manner. From the environmental and social drivers overview, it's important to note that growing stray dog populations linked to poor waste management are really can be really observed everywhere if we have a waste crisis. Something that happened also in 2014, if you remember, in Lebanon. Climate patterns and seasonal food availability affect dog behavior and human exposure risk. High-risk groups, as we said, like children, agriculture workers, displaced population, remain inadequately protected, unfortunately. The situation in the MENA region over time, during 2000 till 2025, we have several major rabies events. For example, between 2000 to 2005, particularly in Egypt and Morocco, we observed an increase in dog-mediated exposure incidents, prompting early local vaccination campaigns. Between 2006 to 10, Iran had a spike in human rabies death due to wildlife-mediated transmission in rural provinces. Algeria had a national campaign to vaccinate the dogs, but cases remain high. Jordan and Lebanon started initial steps toward One Health coordination. In 2011-13, we had the Arab Spring disruption with breakdowns in municipal services in Tunisia, Libya, Egypt, and Yemen. And because of this, we observed rapid growth of stray dogs population. In Syria also, during the conflict, we had a severe impact on vet services. In 2015, Morocco was identified by WHO as a regional priority country due to persistent human cases. In 2017, I remember we were in France, in Annecy. We had a regional workshop grouping MENA region and Eastern Europe, Central Asia, and North Africa, as I said. We had a paper after this workshop, Rabies in the Middle East, Eastern Europe, Central Asia, and North Africa, building evidence and delivering a regional approach to rabies elimination. So it was like an alarm to incite all the countries affected to start joining efforts in order to fight rabies. In 2018 and 19, Saudi Arabia and UAE strengthened their border animal control and dog importation policies, and their human transmissions became rare. Between 2020 and 2021, the COVID era, region-wide impact, the vet and municipal services were disrupted. The vaccination campaigns paused in several countries. Stray dog population increased in Tunisia. Morocco reported higher rabies exposure incidents consistent with service disruption. In 2022, MENA countries endorsed the updated Global Zero by 2030 roadmap, but implementation remained widely variable. Between 2023 and 2024, North Africa, such as Algeria and Tunisia, reported ongoing difficulty sustaining vaccination coverage post-COVID, and Egypt, urban stray dog incidents prompt new discussions on mass dog vaccination. In 2025, One Health frameworks expanding in Gulf countries, Jordan, Tunisia, Lebanon, but practical field implementation remains limited in fragile states. Scarcity of post-exposure prophylaxis is still a concern in many countries. Stray dog control remains the top challenge across many countries. The One Health is considered the golden framework in fighting rabies. What's One Health? It's an integrated approach linking human, animal, and the environmental health. Each sector has its own responsibilities. For example, human health should focus on providing post-exposure prophylaxis treatment, wound care, etc. The animal health should focus on dog vaccination, population control, etc. The environment community focus on controlling stray dogs, waste management, awareness. But effective elimination demands coordinated actions and surveillance, financing, and data sharing. It's very important. Multi-sectoral collaboration, MOPH, MOA, Ministry of Agriculture, municipalities, NGOs, vet services. Everybody should coordinate with everybody in order to be able to fight rabies and sustain our activities in eliminating rabies. The key components for One Health in practice, first, as governance and coordination, it's very important to establish a national One Health task force involving relevant sectors. And this is something Lebanon has done since 2019. Unfortunately, as I said, we need money because the leadership in this issue is usually the Ministry of Agriculture, and they don't have money to go and implement the strategy for elimination, for rabies elimination. So then the surveillance and data sharing is very important. We should have a bite reporting system, different labs for animal and human diagnosis. We should have integrated dashboard, everything that can merge together or integrate together different sectors. Mass dog vaccination, as I said before, we should reach 70% of coverage and maintain it in order to achieve the herd immunity needed among the dog population to fight rabies. And of course, we should prioritize the high-risk zone in which we should focus on these vaccination campaigns. Equitable access to post-exposure prophylaxis for humans is also very important. Wound management, vaccines, and immunoglobulins. Again, I stress on immunoglobulins. Community awareness and behavior change, dog bite prevention, responsible dog ownership, school programs to make like awareness sessions for students, municipal waste management linked to dog population control. Monitor and evaluate progress, set KPI, dog vaccination coverage, bite report, PEP access, number of human exposure, etc., who received PEP, etc. How can we monitor progress? Through dog vaccination coverage, percentage of dog population vaccinated, number of reported bite incidents for human sector, PEP access rate. The goal is to achieve 0 death due to dog-mediated rabies in the world, and of course in MENA region. Joint human-animal dashboards, regular review meetings, corrective actions, and to ensure sustainability, we should ensure budget for annual campaigns, integration into existing health veterinary services, and community ownership. Challenges and opportunities in the MENA region regarding rabies. We have surveillance gaps, delayed bite reporting, incomplete animal diagnosis in almost all the countries in the MENA region. Dog population and vaccination coverage, free roaming dogs, limited campaigns, all these are considered among important challenges. Access and cost of PEP and immunoglobulins, resource constraints are also challenges. As opportunities, we can work to leverage existing veterinaries and public health infrastructure, mobilize municipalities and NGOs for dog vaccination drives, use regional frameworks and donor support for One Health collaboration. Regional and global synergies include being part or being integrated into regional networks for knowledge sharing in MENA, Arab states, and leverage external support from WHO, FAO, WUHA, Global Alliance for Rabies Control, etc. We have many and several international NGOs who are interested and willing to work toward rabies elimination. Regional collaboration is key, cross-border dog movement, shared challenges. We should also align with Global Zero by 2030 timeline. National plan should reflect regional, international best practices under One Health approach. Call to action in the MENA region. Of course, rabies elimination is feasible across the MENA region because in many countries, we have the tools, we have the SOPs, we have the guidelines, we have the plan, the strategic plan, we have the expertise, and the One Health approach works. All what we need is to implement. So MENA countries have a collective window of opportunity. They should strengthen coordination between human, animal, and environmental sector, secure sustainable funding, expand mass dog vaccination, and ensure equitable access to post-exposure prophylaxis. Zero human death from dog-mediated rabies by 2030 is achievable region-wide, but only with urgent, unified, and decisive action. Together, across borders and across sectors, the MENA region can achieve rabies elimination. Of course, AI, now the new technology, we can use it in order to facilitate our work in many domains, in many areas. And of course, rabies is one of them. AI can fill many of the structural gaps identified in rabies and prevention and response landscape. Its contributions align directly with all pillars of One Health. So AI can do a lot of work in human health, animal health, environmental, governance and coordination, community-wise. We can do a lot of things using AI. We can strengthen e-wars. We can do mapping for the population, vaccination, dog populations, vaccination optimization. We can hotspot waste-related areas, stray movement patterns, we can use unified data dashboards, automated alerts, etc. And for the community, we can use targeted messages, chatbots, etc. And of course, all this will have a great or a big impact regarding early treatment, fewer deaths, reduce the reservoir of transmission, play a big role in the long-term prevention and faster cross-sector response and better awareness and safer behavior. Now back to the case scenario we started with. Between One Health strategy and One Health tragedy, only a few letters differ. So what went wrong in this case, and how the One Health strategy fails, or how the One Health approach fails. First, regarding the human sector, we had a lack of awareness, scratches ignored, so no post-exposure prophylaxis were given to the boy. Regarding the environment, we had waste management issues. We used to have it and we still have it in Lebanon. Conflict disrupted area, Lebanon is facing a lot of conflicts. And regarding the animal sector, no vaccination coverage, free roaming dogs were in touch or in contact with the puppy owned by this teenager. And this is what led to the tragedy we witnessed. This story shows the human cost of gaps in coordination, a reminder that sectors should speak with one voice. The gaps lead to a tragedy that was entirely preventable. Puppies rarely get rabies became a tragic misinterpretation of risk. Why this case matters? It's important to note that this child did not die because the tools were unavailable, but because the system was not connected. The human, vet sector, and the community Each had pieces of the truth, but unfortunately, there was no shared understanding. A One Health approach would have saved his life. One child, one preventable death, a reminder that rabies elimination depends on every sector working together. I will show you now some of the rabies data in Lebanon over the years 2001 till 2025. Rabies exposure map during all over the years. Here you can see every 5 years, I'll show you a map of Lebanon, where the darker you see, the darker the area you see, the darker we have, the bigger the incidence rate is. So as you can see, during 2000, we had a lot of light color areas all over Lebanon. And with time, the darker areas become more and more. Here you see in 2015 what happens, in 2020, and now we have rabies all over Lebanon among animals, and we have exposure, human exposure, also all over Lebanon. So we can say that Lebanon, unfortunately, like a lot or almost all other MENA region countries, we are all endemic in rabies. Sources of rabies exposure, unlikely that what is believed by people. They think that stray dogs are the main source of exposure. Actually, no, the domestic dogs are. So here you can see all over the years that till now, the biggest threat are the domestic dogs, which remain unfortunately unvaccinated, and which entered into contact with stray dogs or stray animals and get bitten, and then they became rabid, and then they attack their own owners. Can you believe it? They attack their own owners. The reported death from 2010 till 2025, as you can see, usually we used to have 1 to 2 deaths per year. What happened in 2022 and particularly in 2023 is that the Ministry of Health had a big shortage of vaccine, and that was reflected by the increased number of deaths observed by that time. And here you see the rabies case versus vaccine distribution. In the graph, the upper graph, you see the vaccine distribution that was severely disrupted in 2023. We used to provide like 8,000 vaccines to the centers. In 2023, we only give around 1,000 and a few vaccines, and this affected severely the treatment of the cases. Okay, here we see the bite cases distribution versus also the vaccine distribution. Before 2013, we used to have like 1,500, less than 2,000 vaccines per year. But suddenly, in 2013, the number increased to reach 3,000, and it continues to increase over time till, as I said, now we are using like between 8,000 to 10,000 vaccine per year. What happened in 2013 that had this great and important impact on our consumption of vaccines is the Syrian crisis. So all the refugees, the influx of refugees who came to Lebanon severely affected the program and the consumption of vaccines. As a conclusion, we can say that rabies elimination is achievable, but we should all work together. And in order to do it, we should adopt the One Health strategy or approach, which offers the roadmap, and together we can make rabies history. At the end, I would like to show you a video, and sorry, because it's really a video that it's a tough video, but I insisted to show to you in order to see what we mean when we say hydrophobia and how can patients really can suffer from hydrophobia. This is a Syrian child who passed away in 2023. And it was the first time during my career that I see the hydrophobia, like a hydrophobia like this. So you see, despite all the efforts of the mom to give the water to her child, he was unable to drink. Thank you, and hope the subject was interesting to you, and hope we'll be all working together in order to fight rabies. Thank you.
Thank you. Thank you very much, Dr. Birri, for this presentation. If anyone has any questions, please feel free to submit them in the Q&A box. We do have one question, and it says, will we get certificates of attendance? So unfortunately, we currently do not provide certificates of attendance for webinars. However, if you're interested in more structured learning related to epidemic and pandemic preparedness, and as Noor mentioned, we do have the certificate in epidemic and pandemic preparedness, and there is a course prepared by Dr. Atika Birri as well. So this is available on our online learning platform. I will link that in the chat as well. So if you have any questions, we'll just give you a few minutes to put them in the Q&A box. Okay, so we have a few questions. I don't know if Dr. Birri, you can see them.
Yes.
Okay, please feel free to.
Yes. I saw a question regarding the immunoglobulin distribution in Lebanon. Actually, we have like 10 centers of anti-rabies control related to the anti-rabies control program in Lebanon. And yes, we do provide these immunoglobulins and vaccines to these centers. Unfortunately, we used to have a severe, as I said, the severe shortage in providing PEP in general. And then WHO used to help us during the last 3 years to provide these PEP medications. So now we do have them, but in limited quantities. The Minister of Health, the current Minister of Health, is working to buy again these essential medications, and hopefully by the beginning of the new year we'll be able to have more quantities and to distribute in bigger quantities, inshallah, hopefully. Any other question?
I think there's another question. If we suspect rabies as clinicians, what's the Ministry of Public Health's hotline?
Okay. I don't think you should call the hotline. You should directly refer to the closest anti-rabies center. And these centers are distributed all over the country. As I said, there are like 10 centers, and the names of these centers are available on the website of the Ministry of Health. So in every governorate, we have like 1 or 2 centers. However, the hotline is 1214, but it's better to refer directly to the center.
To the center, to visit the center.
Yes.
Perfect. Riem, do we have any additional questions? Because we're good, we're right on time.
We do not have any additional questions. So I think we should bring the session to a close. I would like to thank you all for joining us today, and thank you again, Dr. Birre, for your time and your insights.